just to be sure that we're uploaded like we need to be.
Right.
Ron, how did you do the background that you've got there?
If the camera on whatever you're using is good enough, you can go on the Zoom app and under
Right.
settings and then under virtual background, and you can add pictures or GIF files or whatever and have that behind you.
I see. I knew that people had done that with the Golden Gate Bridge and whatever. That sort of looks like our building.
It is.
And that's what I couldn't figure out is like, how did you do that with our building?
Pulled it off the internet.
Ah, got it.
The lighting here.
Hi, Pat.
Hey,
Hello. Well, we got 4 board members. You're gonna have 5.
you turn that on, that's what I do.
We're closing in on a quorum.
Hello, do I make quorum?
Not yet.
Not yet, David. We're working on it.
But I'd better not leave because I might prevent it.
That's
Well,
right.
that
Don't
would
leave.
not be okay.
Oh, okay, we won't do that.
Yes, for a moment you moved off the screen and it was like, uh-oh, where did he go? Come on back. Come on back.
I'm happy to be here.
We were gonna count your window for the quorum.
Okay, there you go. And the plants in my backyard, perhaps.
Right. Hi,
Good
Bob.
evening. Hello.
Hi,
Everyone
Bob.
doing well? I'd say, is everyone doing well?
Doing well, Bob.
Good.
Yeah.
I mean, as well as one can do in this mess that we have going on.
Yes,
Considering our age and that every 2 seconds, someone tells us how we're old and vulnerable.
Old and vulnerable. Old and vulnerable.
I'm sick of that.
Hey, Pat.
Yes,
Yeah, you're old and vulnerable.
you're not? That's only me, right?
No,
Just
I'm
a reminder, we
older
are
and vulnerable.
live. So just a reminder.
Hey, you know,
But if I might express a concern in my business, which of course by its very nature creates tension, illness, serious illness, injury, and so forth,
Mhm.
and animals. We, and this is receptionists on down, are detecting a slowly increasing, and I use the word graciously, testiness. The fuses are shorter. No, and this is serious, you know.
Uh,
You can talk about meltdowns. You can talk about road rage, and so forth. And I've talked to other people in other occupations. Fuses are shorter,
Mhm.
and frankly, from a mental health point of view, for those of us who consider ourselves, reasonably well balanced, I'm asking myself occasionally, what is bothering you? Can you control your tension? It needs to be considered.
Mhm.
I agree with you.
I think we're not very tough.
Interesting.
Mhm. We've been really lucky,
That's true.
and nothing has taken very long for us. I mean, I get ticked off when the computer doesn't come on fast. And let's
Right.
face it, we're not very tough.
We're very fortunate.
Well, let me pick up on that, Patricia.
Mhm.
Is our parents, I think, are considered part of the greatest generation.
Mhm.
So one might ask philosophically, what have we inherited? And one could say perhaps this episode is kind of our test. How tough are we? It's worth thinking about.
Well, I feel good.
I'm sorry, Bob.
I say I feel fine.
You're doing fine. Well,
Yeah.
I'm happy for you, and I might lean on you for emotional support someday.
All right. Do what I can.
That's okay.
Ron, it's so good to see you visiting us.
But why
Our
didn't you let me
building
in the
and
building?
the building looks beautiful.
You didn't let me in though. I'm in the parking lot.
Oh my, you're
Oh.
parking, you're on the sunny side of our parking lot
Yes.
today.
Right. I can move the sun, by the way.
Oh my God, he's becoming a tech genius.
I know. It's just,
I love it.
I do too. I didn't even catch that. Wow.
I was working on a whole bunch of backgrounds, but this is the one that worked the best. I got the other one with the woman with the masks on. I really like that one, where she has it wrong and then she has it sort of wrong and then she got it right. I posted that twice on Facebook, but I don't think anybody pays attention.
Can anyone hear me?
Yes.
Yes.
We,
There we go.
I'm trying to figure it out because it's telling me that I'm not on there. I
Well-
see all,
It tells us you're on here twice, Angie.
I'm on there twice? Really?
Yes.
yes, twice.
Uh,
are you calling in from your phone and your computer?
no, my computer, I don't have a phone on my computer.
Okay, that's why her name shows up.
Oh, we thought it was just double love.
This means,
No,
this means she gets 2 votes.
let me find myself here.
Do we have a quorum?
Okay,
Oh,
okay.
yeah, we got a quorum.
We have a
Good.
quorum. It is 6:33. We will go ahead and call the Board of Health meeting to order.
Are we
I
streaming? Yeah.
I
Yes,
think
yeah.
we have any guests to introduce, do we?
Yes.
I'll take that as a no.
No guests.
Excellent. So we just need approval of the agenda for July 21st, 2020.
So moved.
Second.
Second.
All in favor?
Aye.
Aye.
Excellent. Any disapprove? Excellent. We need approval of minutes from June 16th, 2020.
Move approval.
Second.
All in
Mr.
favor?
President,
Aye.
Hold on.
Aye.
Hold on. Yes,
Aye.
yes. Jim wanted to say
I'd
something.
ask that the minutes ended to show that I was at the June 16th meeting, considering that I did make some motions during the meeting. And I've already talked with Christina about that.
Oh, okay. So we need a motion to approve with the amendment that Jim Powers was actually at the meeting since he made motions.
So moved for the amendment.
I'll second that.
All right. All in favor?
Aye.
Aye.
Any opposed? Excellent. We have a presentation today. Javon Bay Hospital discontinuation of acute mental illness inpatient unit at Rockton Avenue.
Is this being presented by Javon Bay?
No,
You
it's
wish.
presented.
Yeah, and I apologize. We've got some background, some feedback, just so,
We do.
so
Pat,
if you're not,
I think it's Pat.
okay,
Pat,
Pat, you may need to mute.
because when I see your box light up, I hear the sound.
Yeah.
That solved it. What you have before you, I was contacted and I shared that kind of email with you by the National Alliance for Mental Illness, our Rock River Valley region, as well as then did some follow up with our Community Mental Health Board on this particular application because they had kind of reached out for a letter of opposition on this particular project. And so what I asked them for was some information on the actual, that they're pointing forward to the Health Facilities Review Board. And so in full disclosure, I want people to understand that I'm on that board. So I have to be, this is part of public record though, and it can be pulled down for that part of it. It is a discontinuation of a service which requires approval by the Health Facilities Review Board, and they are asking to discontinue their acute mental illness services. And so what you see is the application they put together. They have to demonstrate their safety net impact. So maybe page 21 of 182 would be an important document. One of the things that they have to indicate is what that impact might be and what they're projecting out. And again, they have to do they do it for a certain 3 fiscal periods prior to the application. Again, so that's why you don't see the 2019. Other things are certifying like that they're in good standing. But again, when you look at what they're talking about is the actual utilization of the actual facility has been declining. And again, this is inpatient acute mental illness. This is not pediatric scope of service. I mean, I think there's a lot of miscommunication and misunderstanding. When you get to, they provide all of their kind of information, probably the next part, I know it was such interesting reading, I'm sure of it. But you can see that the letter from NAMI, which is on page, well, I'll really start with the letters that came in. Then the first thing that typically will occur is they will ask for a public hearing, and that members of the community did request a public hearing. And then you see the letters of really in opposition to that. And this is on the Rockton Avenue campus. So you see both the letters requesting the hearing, as well as the posting of the letters of either support or opposition. And so probably the next one that you really want to take a look at, which is page 91 of 182, which is what Mariana Abadi, who is the president of the Community Mental Health Board for Winnebago County, I asked her to provide the documentation that they were submitting, or their kind of background information. Clearly, we have a concern, as you know, it has not changed from the time that the assessment was done, and related to the Community Mental Health Advisory Board, of which this became the successor agency, the Community Mental Health Board, was that there was a need for what we call stabilization or crisis management services for both pediatric and adults. And so this kind of flies in the face of that. And you see that they're, again, the beds being there, what they need. I think the other concern was that Mercy indicated earlier in the year of their inability to reach a contract agreement with several of the managed care providers in the state of Illinois for services. So that may have been an influencer and impactor on the beds. So again, kind of to give some background, this is a service in the community that our mental health board has weighed in on and indicated that they feel that it's premature at this point to discontinue a service that's vital to the community. That was part of our assessment of need. And again, that's kind of the overall sentiment. I think the other letter that I really want to kind of point you out to, which has a little more detail and substance behind it, was from the NAMI. Again, and I think we have to be cautious about this in the sense of that, again, looking at what they've indicated, psychiatric hospitalization is often a last resort for individuals with acute mental illness. So that's the AMI designation you see throughout the document. And I think there's growing concern that we continue to close that access off in terms of acute management. This is crisis stabilization. This is not outpatient services. And I think Angie probably has some additional thoughts or comments on this. And if you remember, there was some commitment to the community when they essentially went for the application or certification of need for the Javon Bay Riverside campus. at the time of remaining and maintaining their commitment to a facility on the west side in this location. So that is where we stand at this particular time. Obviously, this is only one data point, or again, before we go through, I wanted to at least have an overview of what was being asked and what the service was that was being discontinued or proposed to be discontinued.
Who makes the decision about a public hearing?
What will happen is if there are requests for a public hearing, then the Health Facilities Review Board will post that they publish it similar to, I'm going to say, notices in the paper. They have to run it for a certain number of days. And Angie has already seen the posting for the hearing. Angie, can you?
Well, yeah. Am I on?
Yes.
Yes.
All right. First of all, I saw the posting, and as I read the posting, it was in the classified ads. I've asked other people if they've ever seen it, and they said no, they had no clue. Even our new Board of Health had not seen it. They didn't know anything about it. And the ad was so small. And this type of an ad, to me, to have it in the classifieds, how many of you read the classifieds every day? Nobody's answering me?
Nope.
Well,
Yeah, I don't even read them once a year.
well, it says in there, notice of opportunity for a public hearing. Now, this came up with a date, if you wanted to have a public hearing about it, the exemption application was called complete on July 2nd, written results, no emails, no fax can be accepted, and they all had to be in by July 17th. This was the same week. It's like, yeah, we said, sure, we'll do it, but you only have 3 days to get a letter into me, or a week to get a letter into me, if you saw this. And this happens to be in my district. It's not very far from me. And when they first, Mercy decided to buy Rockford Memorial, they interviewed a lot of us. One of the things I said that I thought it would be great if we could have an adolescence assessment center there. And I never heard back from them again. And then the two gentlemen I talked to, I tried to get a hold of them after they gave me their cards, and they were gone. They weren't there anymore. This whole thing, when they decided to take over Rockford Memorial, it was only a 10-year deal. So now what they're doing, trying to thin everything out. They've already closed out I believe they called it the Brain Center, which we had an ALS center there that no one else had in Northern Illinois. It's gone. They have taken away so much from this campus that little by little, they're just, in 10 years, it will, well, they only have a few more years left. It'll be vacant. And so they're finding different ways, backdoors, how to eliminate different sections of that hospital. And I think even part of the trauma center is gone from there too now. I just had hard feelings. Yeah, I'd like to have another public meeting on this. We've lost a lot of employees from this side of Winnebago County, going west, north, and south of the Rock River, because we have employees there that come even from Stevenston County, Ogle County, even some from the Beloit section. So they're going to take everything and they're going to put it out there. This whole area is not going to have a thing left anymore. And as you see, they're trying to get rid of a lot of the people who are on Medicaid. They don't want. And so this just leaves a sour taste in my mouth because it's my area, and I've seen this, I just hate seeing this happen. And what they have promised this area that they would keep, well, they haven't done it. So I don't know. I'm very confused about the whole thing. Alderman Rose, who has the majority of his ward, is in Rockford Memorial District. and he wrote an excellent letter, and he's been fighting with this also. And I believe he too wants to have a public hearing on this. He has, he's even got shirts he's going to have written up about, "Don't take this away from us." So that's my thing on it. I don't know where we'll ever get with it. I think they'll have a public hearing with earplugs in their ears, and that's where it's going to stay, because their thing with the contract with that was only a 10-year contract.
Angie,
Yes?
a few months ago, I thought I read where they had planned on a $50 to $70 million remodeling or upgrade to that facility. Was that false?
No, what happened was, if you remember a couple of years ago, they got flooded in their basement. And the reason they tried to sue the city of Rockford for that, saying that we had a very inadequate sewer system in that particular area, when it was their fault. If you've seen the film from the television, and I saw it several times, that water was coming into their basement. They kept all their records. There was a lot of things that they had in the basement over there. And that was coming down, any of you who know anything about flat roofs, you know the drainage for the roofs come through the building and then out into the sewer. And this here broke, and it was pouring into their basement. And they wanted the city of Rockford to pay for that. Because when they get ready to sell that building, if it's in poor condition and those things aren't done, do you think they're going to get any money for it?
I understand.
No. So I understand why they're putting money into it. It's going to be for sale, and that's what's going to happen. Other buildings tore down around there. And so if you know anybody who wants to have a new campus, that'll be a great one for you.
Just to give some perspective and background. So if you go on to the, first of all, they will have a public hearing because they received the request before the July 17th date. So that's posted on the website. In November of 2019, they've been kind of active in submitting applications since I've been there. They were approved just at the Rockton Avenue campus. Is the establishment of a 17-bed subacute unit at the Rockton Avenue campus. So they were approved for that in that particular area. So just, I know that I want to make sure that they seem to be investing. They have to submit when they're changing a level of service or adding a level of service, and they submit a budget. So there is some investment going in that. So they were converting the currently vacant former pediatrics on the Wing B, and they were turning that into a subacute rehab unit hospital. And that was an approved project in November of 2019.
I have a question. In the letter, it mentioned that some discrepancy in the numbers that they submitted census data to show why they can no longer support the unit. But then they state, whoever wrote the letter, I'm sorry, I didn't have it up right here, stated that the people that actually work on the unit and the ER data shows that those numbers were inaccurate. Or did I read that wrong?
No.
I think that's important.
Yeah, I think it's it's the NAMI letter on page 87, if you're following along in your packets. And it talked about from their actual application. And this, again, you will see that they're saying that they have an average daily census of 9.6 and on a 20-bed acute MI unit. So about roughly half of their beds are filled throughout the year. There was some additional, apparently there was a meeting of the Community Mental Health Board, from what I can read from the letters from both the one from President Abadi and then from NAMI, is that they met with Senator Severson and Stottleman. And there may have been some numbers that were shared verbally that did not match what was in the application. So they pulled the numbers out of the actual application. If you see acute mental, pulled from the app, And it shows you exactly where they pulled it from: 14 peak beds, 593 admissions, 3,521 inpatient days, and 5.9 day average length of stay. Now, and again, I think the 47 public adult beds were part of the Singer unit. So when these were approved for beds, probably at the time, that was with knowledge that there was a need for beds within the community. And I'm not sure on the exact number on an acute mental illness unit, how many beds is a minimum. And I have to be clear with you, I don't. Let's see if I can pull that up in the statute. While we're
Does seem that their utilization in their figures looks low. It's confusing that when in Mariana Body's letter, when they talk to the providers from the unit, that they seem to feel that it was not that low.
Well, they have to certify these applications. How can I say that politely? And you know that they have to submit these to data points throughout. And I'm not, perception of what's busy, what's not. I can't, that's always a challenge, as any of us know. We go through this every day. How many people were contacted? How many people were? And it's their perception. And so I can't, and so I can only go by what was submitted. Now, at the hearing, at the day that this application will be submitted to Springfield and they're going to hear it, let's say, that's outside of the public hearing. So when they have the public hearing, they will put together all the letters, all the speakers, all the testimony. From those of you who remember when we did that the last time, that also goes into the packet. The day that that application in its entirety is presented to the Health Facilities Review Board, then there is additional 3 minutes of testimony provided by, from both sides can present, and then the board itself can ask additional questions. So for instance, if someone were to challenge that number and say, can you explain that difference, or that, then they would have to produce. But typically these applications are certified. I can't, so again, I don't think they can get too far off on the numbers. But I have to cautious us that, they did point out, though, what was verbally told to them in the meeting with the senators is different than what was included in the application. And so the application is what stands at this time.
Well, it would be nice if the numbers in the application actually were correct, because in their charity care numbers, the numbers don't add up.
Well, that's different in the charity care, right? So the mental health beds may not be charity care, right?
Yeah,
They
that's
simply, it's an overall of their facilities, and they have to submit it for each location. I'm just saying that this is something, it's considered in isolation of that particular unit. It's the overall impact on the percent of charity care that would be provided by the institution. Does that make sense?
Yeah.
Mm-hmm.
Where will the hearing be?
The public hearings are usually local, so they'd be like at the library, or it'll be a public place. Of course, now we're in the day of COVID. I think that they'll be planned out a little bit differently, and how will they make arrangements for that. But when they will go through that process at the state schedules it. It is announced, and it's not just in the classifieds per se, to get out there. And obviously both sides, or camps, I'm going to call it for term, will get the notice out and the word out for people to come and provide testimony, yay or nay, or, their support or not support of it.
Is anything being asked of this board at this time in relationship to the request?
We were asked, and the outreach to us was, could we provide a letter in opposition to this project?
Somebody say something.
Can we, as a board, I I support that. Do I have to make a motion?
Yeah, yes, you would make a
Yeah.
motion and then we would draft a
I
letter
make a
for,
motion to draft a letter in support and not support of this
in opposition
process
to
that they're, yeah.
the
I'll second.
discontinuation of the mental health. Okay, I can make sure we get that together.
I'll second.
Any discussion?
Yes, I'd like to have Jim Powers' opinion on this.
Anything in
And I-
particular, Andy? I think, part of it is a whole needs assessment kind of thing, and you and the previous mental health group, put together, a, in essence, a needs assessment, for the types of services that were needed. And my recollection is the type of service that we're talking about was one, and I think you referenced this earlier, Sandra, was one of the ones that was necessary. So that's where not to, I know we're moving towards outpatient, kinds of services, but it seemed to me that there was some need for this particular type of service based on that particular needs assessment. Am I wrong?
No.
No, that's correct. I mean, the crisis stabilization was one of the top priorities, followed by pediatric inpatient and outpatient care, and then really kind of coordination or support, right? And remember at the time we were making some plea to, as Mercy began their pediatric center of excellence, to include mental health in their pediatric centers of excellence.
As you read through this document, you'll also see that they mentioned they have a clinic, which did belong to Rockford Memorial, over on Glenwood, just around the corner, and that they would still be servicing some people, some patients there, but it wouldn't be a place they would stay. They would just probably go in for to be assessed or whatever. I don't know, but you have to read it. And I read it earlier today, and I don't remember it verbatim, but they had mentioned that in this document.
I thought that was purely an outpatient kind of clinic.
I think
It is,
I think.
It is.
Mm-hmm.
yes.
We'll go ahead and call the vote. All in favor?
Aye.
Aye.
Any opposed? Let it note that I abstain.
I want to abstain because I'm reluctant to say that I know people should maintain a service that is that they can't maintain financially, and I don't feel like I have enough information on need. If people are really staying in emergency rooms and they can't be treated and they're being held in emergency rooms for days, that says to me there's a need. But it's like there's a whole hole in my information, and I'm really, I don't know what to do.
What they're ending up going to do is they're going to be dumping all this on Swedish American.
But Swedish American isn't saying that about the application.
No, Swedish American isn't at this time because they're not involved in the application. But that's where everything will go. It'll just be passed. There's a couple of maps in there showing where hospitals are located in regards to. But you need to go, if you have time, do a little bit more research through those documents. I started doing it today. I spent quite a bit of time this afternoon looking at them, and I was totally confused because one place they say one thing, another place they say something else.
Well, and I agree with you, Angie, and I did read the whole thing, and I just can't find that Swedish American is saying they're overfilled.
There was something someplace. I heard this someplace. I can't remember. I think Alderman Rose and I were talking about this. This could be, and he was under the impression that a lot of this will also be dumped on Swedish American.
Well, and again, part of the process will be, and we don't see that yet because this is the initial app, then they go to public hearing. Then there's, obviously letters. They must get letters of support and or notify surrounding hospitals of their decision. So that's also part of the process. And I did not see that in there. Obviously, they have a staff at this board that's job is to go over these with a fine tooth comb. They actually do some recalculation and checking against the other databases in which they have to submit to. Unfortunately, this is the information that we have to work with to make a decision. And we can certainly be a little, I'm going to say not, we can say softer, saying an additional assessment is needed to determine the impact of a closure of this type of service on the community. We could certainly be, I'm going to say less, that on the face of it, kind of citing that kind of thing. I can make it a little more neutral in the sense of we understand a hospital's decision about financial viability. However, we do not have sufficient information to understand the impact that a closure would have on our other healthcare facilities and or the population's mental health. Especially during the COVID crisis, we can say that, we can use that as a lot of excuses for, I shouldn't say as an excuse, but it's another rationale. It's hard to assess right now what the impact of this will be. We already know we have a lot of people, we haven't even returned to school yet. We know we have a lot of people that are having a hard time transitioning back to working, the work environments, the congregating environments. And so we really don't understand what the impact might be over the longer haul on this.
And I'd be fine with that. I would support that kind of letter. I just feel a little reluctant to support a letter if it says, we are sure that we're against this, because I'm not
Right.
sure.
I would also support the fact of the type of letter that you outlined, Sandra. Because I think it's very accurate in terms of what the situation is. So I agree with Pat. I agree with your letter.
Yeah,
So-
I'm abstaining as a Swedish American employee and Swedish American stakeholder to avoid any potential conflict of interest, since this is Javon Bay Mercy Health. So I'll leave the tone of the letter to the rest of the board.
So, Madam Vice President, if I draft it, would you be willing to take a look at it and then review it on behalf of the board?
Sure.
Would that be good with the board?
Yeah.
Yes,
Because Dr. Williams then as the president will not sign on that letter, correct, Charlotte? Since he's abstaining and he has identified a conflict of interest. So Jamie, you would, as vice president, would be the one signing on the letter.
Yes, that would
That's
be
fine.
best.
And if the letter looks like that, I'm willing to not abstain and to vote yes.
It's okay. Do we have any other abstentions? Because I think again, we kind of, we could circulate the letter, but I don't want to have to revote it, Pat. You know what I'm saying? I don't think I want to make sure we're clear on our procedure here. Charlotte, is there anything else I should be cognizant of on that? Okay.
Okay. Moving on, because this kind of does really go into it, not to be funny, but in the president's report, we need to talk about a potential proposal for a mandatory mask in Winnebago County. When in public, people wearing masks that covers their mouth and their nose. And I tie that together because if you looked at Facebook or the news, anything like that, that has been apparently controversial in other parts of the country, sparking protests, burnings, and sometimes violent actions. by people as they're stopped from entering establishments, buildings, for not wearing masks.
And again, this is kind of giving, and really had just kind of brought this up to Dr. Williams. There's growing, I'm going to say, support or request from the community. We've had municipal support, including the city of Rockford and our larger municipalities, along with the Chamber of Commerce and the Hotel Association and the Illinois Liquor Group. I don't know. The number one complaint, I want to be clear with everyone, the COVID-19 hotline. So we've gotten through the testing, getting results out to the community, has been complaint of either the part of businesses not to, or employees and or mask enforcement and or customers not wearing masks. So both sides of the, I'm going to say, the world are concerned. And beginning to take a look at how we can move through this. We obviously spend a lot of time doing one-off education. Obviously Todd goes out and his code enforcement staff, but there's growing concern that we're going to have to get tougher on this kind of, how do you get to that point of really doing some degree of enforcement, especially as we return children to school. This is going to be a challenge as we move forward. And so I had asked Charlotte to also work through the state's attorney's office to kind of find out what's on the books in other areas or regions, what's been included or not. Obviously we do not want to make this so onerous that people don't want to comply. That's not the goal of this. The goal is to get more people to comply and minimize the, I'm going to say, the controversy that, kind of the in-your-face kinds of encounters that people have to get into on this. If everyone understands what the rule is and they understand what the penalties might be, that both parties might be better to come into compliance. Charlotte or Todd, do you want to add to that?
No, that's a true statement. We are getting, obviously there's been a huge number. It's a public outcry regarding masks, and that is the number one complaint, Dr. Martell. So I do agree with that. The consensus that my staff and I'm having, it is a public request from what I'm getting for some type of ordinance. There's been some advocates that has actually reached out to me about this. This is, again, not uncommon throughout the nation, but also in the state of Illinois. And I'm glad that at least we're looking into it, see how we roll this out, working with the state's attorney's office, but yes.
Todd?
Yeah.
What's the consensus? People objecting or not objecting to masks?
Oh, not, is the concern that people are not wearing masks.
Okay.
It truly is. I would say that is probably 95% of all the complaints, or probably even 99% of them. And I know Cynthia, she's looking over the COVID emails, and I think she would agree also. It's overwhelming. It's not only the employers and the employees, it's actually the patrons coming in. People are scared to come on in. And if they are wearing masks, they're not wearing them properly. And we've gone out to these facilities, continue to educate, and Dr. Martell is right. There just doesn't seem to be compliance. It really doesn't. So
I understand the inconvenience, and I understand people wanting their whatever individuality, but this is a public health crisis. There's numerous videos on YouTube. There's numerous videos that have been shown on multiple television outlets, including recently locally, where they went to the microbiology lab at Swedes and showed the difference in growth on the Petri dish from just talking, laughing, and just having regular conversation, yelling with the mask on and the mask off, and put it in an incubator and showed the normal respiratory flora growing rapidly and aggressively in the dishes that the person was a mask, and the same statements at the same distance when they're masked. And this was just cloth masks. It wasn't an N95 or nothing into that nature. And there was no growth on the Petri dish. we're trying to increase phases and trying to get businesses back to being able to employ people and get life somewhat regular. And the best way we know how in the medical profession right now to prevent this is with masking, proper masking, covering the nose, social distancing, and washing your hands. And the importance of the mask cannot be denied. Even in Washington, I want to say, I think I read today, people who have been not wearing a mask and denying it is now acknowledging the importance of wearing a mask. I think that's the one consensus you can get from all medical professionals in society is to wear the mask.
Well,
Now,
and
What can the health department say, or what kind of teeth can we put behind an ordinance outside of just saying that as a health department, we recognize the importance of wearing a mask and the safety that comes from it?
I can speak to that if you'd like.
Okay. Yes, please.
Okay. So the Board of Health has the authority to recommend to the county board ordinances for the let's see, let me read it exactly. Recommend to the county board such ordinances and such rules and regulations as may be deemed necessary or desirable for the promotion and protection of health and control of disease. So you can make a recommendation to the county board. They have a certain authority that will allow them to make it a petty offense to violate the ordinance. So we could set a fine, it can be minimal, $10, $25 or something, but something to at least encourage people to comply. And I think the municipalities are really supporting this because they don't want to go backwards. They know they have people that live there that don't want to wear the mask, but they don't want their businesses to close again. So I think as Dr. Williams is right, this is one way to try to ensure that.
Good.
And I also think that, with the governor announcing last Wednesday, the new tiered approach to rollback, you saw where the impact was going to be if the disease levels continue, if they continue to increase over this time frame. I also think that as we return, there's kind of a linchpin on this as well. As you know, we're trying to, as we bring children back into the school environments, we've got a lot of things that we need to do, right? But the number one thing that's going to be required of the school children and the teachers and the staff and anyone who comes into the school environment will be masking. That is going to be a universal because they cannot, by the nature of the work they do, always maintain 6 feet of social distancing safely in those environments. And that there is, again, we don't know everyone's medical condition, but the idea being that we need to keep the number of outbreaks as low as possible to promote as much as we can in-person educational classroom experiences. Because of the fact that we know that the remote learning, that there may be some that are left behind in that scenario. And so working very hard. So I think it really becomes important to start that societal piece as we roll children in. Because if mom and dad aren't wearing a mask, but the child has to wear a mask in the school environment, we've got another very hard to work through that process.
The other problem you're going to have with the county board is half of them are going to vote this down because they're so far against it right now. They're hateful, and they're actually hateful about this. And if you notice, I believe in today's paper or on the news with our governor, they're saying that he had no right to make all these in such and such a date, that all that is a bunch of bull, that he should never have done all this stuff. My suggestion would be that more and more I'm finding that stores, if they're on television advertising, you can't walk in my store without a mask. I went to a store on South Main Street, and as you hit that door, the first thing that comes over the loudspeaker is you cannot enter without a mask. We're going to have to leave some of this to the responsibility of the people who own the stores, own companies. They're going to have to make their rules. We can make them, and but there's that hate that's out there right now. And no matter what you say or do, they're going to do it their way. And so we're going to have an even bigger problem. I'd like to see more industry. I'd like to see more of stores and other establishments make these rules that so that we aren't all that responsible. I'm tired of them saying that Dr. Martell, who does she think she is making all those rules?
I
And they
second
don't
that
realize
motion.
doing.
Oh,
But I'll tell you right now, we have half a board that would be so much against. And so I want you to double think this. And Dr. Lewis, I understand. Dr. Williams, I understand what you're saying because I'm with you too. I truly believe in it, but that's me. And how many of the average people look at all the documentation that you do, Dr. Williams? They don't. They have no clue. They're too busy with their iPhones and YouTube and listening to all of these blogs and everything else. They don't listen to anyone that makes any common sense. They're listening to the ones out there who have an axe to grind or want to make it look big that they've got the power to say don't do this. So we're really going to have to give that some thought before we go.
I would like to see what this is going to look like. And I think we shouldn't stop recommending something just because the county board may or may not want to pass it. But if we feel it's important enough, then let's work on the recommendation to them. I really want to see what it would look like and what triggers it and what turns it off.
I agree.
Yeah, that's what would be interesting to me. I'm assuming some other localities have done something like this and maybe we have something to look at, but where is this going to start? Is it going to start in policy? Where? Because we don't have anything in front of us.
No, agreed. This is rapidly, as you would guess, evolving. You know, we've gone, I want to say the pendulum swing from, you know, everyone do the right thing, the responsible thing, because it's the right thing to do, has moved into more of this piece of it. And I think, Ron, to your point, I think it really became evident with the tiers that were announced last Wednesday. We understand there's a part in Southern Illinois that's rolling back. And so I think that there's an understanding now that that could happen any place, right? It's not just Southern Illinois. It's not just the city of Chicago. And so I think that that's where the momentum is building. And so in discussing this, I wanted to bring it forward because we might have to pull a policy committee together quicker than our usual couple of 3 weeks from that, so that we can pull together some sample ordinance work, begin to take a look at that. And again, if the community really wants it or it thinks it's important, they then also have the responsibility to take it and apply pressure to their county board members to adopt it if it's appropriate and reasonable and rational.
I think we could fit that meeting in. I know my schedule might have a few openings, like Monday through Friday.
Hey, especially your beautiful building. Yes.
Yes, I'm ready. I'm ready for action.
I agree that should go to policy and they should start working on something. And as a physician, I'm used to recommending what I think to be good ideas that people should implement, that they take it and do what they will with it. But as a health department, I think it's our responsibility to give them the best information possible to prevent a second wave. We don't want to be like parts of Houston and San Antonio because we don't have the capability. Rockford is more of a regional health area, and people don't think of Rockford as a regional health. But if things go wrong at Freeport and other hospitals, they do tend to transfer those patients here to Rockford, and we cannot afford to have all our hospital ICU beds full. And there's 19 or 20 hospitals as of now in Texas that have no ICU beds, which means all elective surgery has stopped. People with gallbladders, people who need rotator cuffs, people who need hip surgeries done have to suffer because you cannot do those surgeries if you do not have a certain amount of ICU beds available in case there's a complication. So that would really paralyze this area and set us back greatly if we had a huge second wave.
I agree
I look
with you.
forward to the policy, what policy committee comes up with.
If I can interject, or maybe this is not the proper time, but obviously we got to have discussions. I know we got to have the science behind it, maybe a positive rate or some, at this point, we implement something or something like that with science behind it, but we could talk more about that later.
I think that's, Todd, when we'll bring a sample ordinance through. And so Ron, I'll set that up. And so the board, for from what I understand from the direction, we will proceed forward with drafting for consideration by the policy committee with their input, and then move it forward to the board then.
Would that be
A
next week?
harder time hearing you, Sandra.
Yeah.
You
some-
know why? Because I was taking a drink of water there. Sorry about that.
Oh,
What I said is I've heard that the direction is to prepare a draft, work through the policy committee, then it will be brought to the board for consideration.
yeah, that's the longest president report I've ever heard.
Thank you. Winnebago County Health Department updates. No updates?
Yes, no big highlights or updates. I mean, not that we haven't all been working on COVID. I mean, I know we entered phase 4 and everyone thought it was over. I'm here to tell you it is not over. We've continued with, right now I know that a lot of grants are coming in for the fiscal year. We're trying to do some closeout. We've been focused on school guidance. Cheryl, maybe want to give a little bit of update just briefly on the WIC EBT. We're so excited.
Yes, the EBT will go live August 3rd. So the staff, they're in training next week. And then actually our cornerstone, that's going to be down at end of day on the 30th. So they can do the transfer of information from cornerstone to the EBT.
So everyone knows that that's electronic benefits transfer. So now the people will get a card rather than all those paper food vouchers that we've had. Are you going to burn those afterwards, Cheryl? Are we going to have a big party?
Bonfire in the parking lot. And it's really a really great benefit to our WIC participants, because now if they lose or if their WIC vouchers are stolen, you can't do anything for it. So at least this way, if that EBT card is lost or stolen, we can immediately just stop payment on that and just reissue a new one. So it will definitely be a great benefit to our participants.
And I think the other part of this is even during the pandemic, remember, we still had to have mailings and curbside pickup of those paper vouchers. The WIC EBT cards will allow them to do electronic purchases. That was part of, so if we have to go in or people can't come out safely to shop, they can begin to use their card like a purchasing card with the benefits on there. So it really is a real tremendous part. And fortunately, we're a little bit behind schedule, but we're excited that our WIC program is moving forward in August. Hard to believe. It's almost here.
After August, for each appointment after that, when they come in, then they'll get their card. So it'll be a while before everyone actually has the card, but that's how it'll work.
Fantastic.
Wonderful.
I'm in the parking lot waiting for the bonfire.
And Peter, do you want to give any update on the Community Health Collaborative and where we are in the assessment processes?
Sure. We're finishing up. The assessments are getting cleaned up and finalized, and now we're moving into aggregating the data across the multiple assessments, identifying the key themes, working primarily right now with sort of the backbone steering group. And then we're rolling things out to share with the larger steering committee of the full group. And so we should have some further updates perhaps for next month, a little more formal to sort of lay out where we are. But the work is progressing despite most folks being pretty distracted with a lot of other things that happen to be going on right now. We are trying to keep those pieces moving as well.
Great.
Anyone else want to add a highlight that you think would be important to share? I know Todd Kizer hasn't been busy at all, so he can.
One thing I can say, I don't envy any of you at the health department right now for all the work you have to do. And people just think you sit around there all day and make rules that everybody's supposed to follow. If only people understood what all that goes on at that health department, it would be a miracle.
Tell them they can volunteer to be a contact tracer with us. We'd be happy to have them on board.
Well, maybe some of them should.
We can move to
volunteers.
Why not?
Yes, we do use volunteers under the Medical Reserve Corps. We sign them up, they get vetted through that. They can't just be a volunteer. They have to go through all of our vetting. Mindy's been coordinating that now in the absence of Teresa and Robert Bland. So we are continuing to use our Medical Reserve Corps, who have been instrumental as we are processing through. And you'll see some of the recs are coming through as emergency purchases. So we're moving forward in both the hiring and the remodel to get our contact tracers on board.
Excellent. We can move to committee reports. I believe we can, I don't see anything for executive committee. And speaking of contracts, finance committee. Jamie's on.
Did we lose Jamie?
We lost Jamie.
We did.
Oh,
She's lost her
Jamie-
internet connection and she's trying to get back on.
Well, I can start this and I will then happily move that to Jamie when she gets back on. First order of business is approval of the minutes from the June 24th, the July 1st, and the July 15th financial committee meetings.
So moved.
Second.
Okay, all in favor?
Aye.
Opposed? Approval of minutes so passed. We will go into a resolution of expenditures on page 101 for the month of June in the amount of $646,673.91. Do I have a motion to approve?
So moved.
Second.
Thank you. Any questions or discussion? None. All in favor signify by saying aye.
Aye.
Opposed? So passed. We'll move into the financial review for the fiscal year of 2020. Any balance of $10,148,761.19, an increase of a little over $500,000. Jim, anything you want to point out on this?
Well, we had a very good month with real estate taxes being applied this quarter, and we're catching up on a lot of our reimbursements, and especially through like IBCCP and family planning and such. So we're coming along pretty good right now, and we've had 2 different grants, but we've been bolstered by the COVID crisis grant that they initiated right away once this pandemic hit. So we've reaped some benefit from that as well.
Thank you. Are there any questions concerning this? Okay. If none, will go into the financial review. It's the information is provided on page 103. Year-to-date revenues, year-to-date expenses. Does anyone have any questions or concerns about those? Okay.
Yes, we're running like 80% of our plan on revenue, but only 74% of our expenditures. So we're doing well.
Very good. Okay. Next, we have the bank reconciliations, our general account, our lead abatement account, our abandoned properties, and our e-pay. There for information. Jim, anything about that? It looks like it's pretty much where we've been.
Yeah, we're we're probably going to consolidate and move some of this back to the county, because the Treasury's been, through the pandemic, they've been spotty as far as when they're in the office. So a number of these will bring these accounts back and move them into our aggregate account, so to speak.
Okay. We'll move into our revenue and expenditure reports. Jim, I'll have you point out anything within that.
Yeah, again, we're doing well, and actually we had obviously the real estate taxes, but also we had quite a month for food service permits. So they've been I think putting out and collecting now that, the restaurants are back in business. So we had kind of a lull there, but this particular month we did well. And then again, with the IBC CP program and the family planning and others, that the reimbursements coming on that. So that's pretty much the story there.
Thank you. If you look on page 122, you'll see our emergency reserve minimum. We are, I believe, close to or at an all-time high for June of this year, which is for this year. That is excellent. We're maintaining. Going to accounts receivable on page 123. Various ones highlighted. Jim, I'll have you go over anything pertinent you see there.
We're just trying to maintain, each program there and keep the reimbursement reports, up to date. And as long as, we've had some delays with the contracting, we have, a number of different grants, about, 20 some odd different ones, but most of them we're fairly timely with. And if the state has lagged, we try and put some attention to them so we get caught up as soon as we can.
Move into major expenditures requests. First being Illinois Department of Public Health, the electronic filing fee for death certificates in the amount of $6,424 for June of 2020. Do I have a motion to approve?
Don't move.
Right. Second?
Second.
Thank you. Any questions? If none, all in favor, signify by saying aye.
Aye.
Opposed? So passed. Next major expenditure request is for a soil boring invoice in the amount of $4,850.
So moved.
Second.
Okay, and Todd, can you give us a little info on this?
Isn't this the standard billing for the soil and water boring samples?
Yeah, during the summertime, these numbers will peak over $3,000 just because it's the season of septic systems. So yes, we do utilize that, so that determines what type of septic system. So yes, that's the reasoning.
Okay.
Okay.
Thank you. Okay. All in favor?
Aye.
Aye.
Opposed? So passed. Our third major expenditure request is to Gary W. Anderson Architects in the amount of $6,000. Do I have a motion to approve?
So moved.
Second.
Thank you. And Sandra, this is for the contact tracing program, correct? Third floor or fifth floor? You're on mute.
For our architectural services, yes.
Yes.
Yes. And this was the one that was passed through the board. And we asked you to approve it electronically so that we could move forward with it on a timely basis. And I apologize, we don't have our table in today, so it makes it a little more harder to follow. But this what you see is the documentation behind it with the vote from all of you. So you approved it by roster, but we're putting it formally on the agenda for you to reconfirm your approval.
Do we need to take a vote then, or no, we just have it there for the meeting?
You have it there for reference. Charlotte,
Okay.
Is there any reason they would need to take another vote?
No, I don't believe so, if they've taken it electronically.
All right. Thank you. We will move to Jamie and let her pick up from pool administrators, page 146.
Okay, what page? What page?
146.
Oh boy, okay, hold on, sorry, I gotta get caught up. Okay.
Thank
We
you.
have pool administrators in the amount of $31,231.60.
Move approval.
Second.
Any discussion? This is for the Ryan White program, the medical and dental consulting. All in favor?
Aye.
Aye.
Any opposed? Okay. Then the next one that we have is on page 151. This is for Empire Today Mohawk new basic carpet tiles, third floor office area, and the removal of the VCT under existing carpet.
Vinyl something, vinyl. Yeah, I forget what that's referring to. It's the vinyl underlayment.
Okay, and this is to.
This is for the third floor space for the contact tracers. So that's to replace the carpet and the underlayment of the flooring on the third floor.
And who are we paying?
This would go to Empire Today as the carpet company that submitted.
Empire Today. Got it. Okay. And the amount is $47,208.
Move approval.
Second.
Any discussion?
I'm sorry, did we
Wait.
get a bid on this?
No, we didn't. No, we did not. We went through the county on this, and it's an emergency purchase. So they did get 2 quotes on it, Dr. Halverson, and they're going through the emergency purchase process. So there is an emergency form. I think that was sent out. Christina, did you send that out today?
Yes.
Okay, she's going to share it on the screen.
Yeah.
We did submit it to the county because of the fact that we cannot go through the normal process because of the time sensitive nature. The carpet has to be laid before we can put in the desks and the cabling. So Christina, we're practicing all of our new technology now. We should have a drum roll.
Da-da-da.
May I ask a
There we go.
There it is.
about that?
That's the wrong one. That's for the computer.
Yeah, that's the laptop.
Surface Pro.
At least we learned how to share the screen. Baby
we go.
steps.
May I ask a question?
No questions allowed, of course.
Parking space rent lease, who are we renting from?
We rent from the Mendelson.
Okay, thank you.
That was an easy question, Angie.
Yeah, well, I kind of forgot. I knew we were using that prior, but I forgot that was that one.
Are you going to ask me how many germs per mask or something, you know?
Oh, I'm not smart enough to even think about it. In fact, I don't want to think about it. Just give me the mask and I'll do what I'm supposed to.
And so the county has been facilitating us, just so everyone's clear on this remodel of the space, getting the quotes. We're working with the purchasing agent and Johns to move this through as quickly and as reasonably. Obviously, this was included in the rent allocation that we put in for the grant and is an approved expense, and the grant was approved.
Thank you.
Any other questions or comments or concerns? All in favor?
Aye.
Any opposed? Okay, motion passes. Expenditure passes, I should say. Okay, 155, page 155 is the next expenditure request. This is to extend existing clinical consultation, expertise, and oversight with respect to the Drug Overdose Prevention Program, DOP. Contract UIC reference number CN 00034073 in the amount of $7,800.
Move approval.
Second.
Second.
Any discussion? All in favor?
Aye.
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 Any opposed? Okay, expense passes. Page 159. This is to extend existing integrated clinic contract medical advisor. Contract UIC reference number CN 00035659. It's in the amount of $21,420.
Move approval.
Second.
Any discussion or questions? All in favor?
Aye.
Aye.
Any opposed? Okay, expense passed. Okay. Is that the last one?
Of
Now
the
we have
Yes. Yes.
proposed contracts and agreements on page 161. This is amendment number 2 to the agreement for integrated clinical medical advisor services between the Board of Trustees of the University of Illinois and the Winnebago County Health Department. This goes from July 20, or no, the new, so what is the amendment here?
Okay, it's a contract, it's amendment number 2, so it's second year of this contract with the University of Illinois for the medical advisor under contract number CN. It ends in 35659. It's from July 1st of 2020 through June 30th of 2021.
All right, and it may be renewed for 3 additional 1-year periods under the same terms and conditions. Okay, is there a motion?
So second.
Any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay, amendment passed. That gets us to the fiscal year 2020 budget amendments on page 165. Do we have to do anything with page 163, the grant agreement?
This is the grant agreement, Jim, you put in for IPHA.
Yes.
It's the agreement to provide the rig services. So it's a grant in the amount of $31,393. And that's for the regional HIV intervention group, correct, Todd?
Yes, that's right.
Yeah, page number is wrong because that looks like what's listed as 161, but this is.
Yeah, I think there's a mess up on that. So apologies to everyone, but we're looking at page 163. So that's a grant agreement to enter into with IPHA, Illinois Public Health Association.
Okay. Is there a motion?
Move approval.
Second.
Okay.
Any questions? All in favor?
Aye.
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 Any opposed? Okay, so now we get to the budget amendments. And this, if my memory serves me, is just moving the $609,032 from account 60100 to account 60404, or is it vice versa?
Actually, it's setting up the project for 60404, and we're moving the 600,000 from the total grant, which is 4.2 million, to a portion of it that we're going to utilize in 2020 for the end of the county fiscal year of September 30th. So we anticipate all these expenses, like the 2/3 down the page where we have the laptop computers and things like that we're going to.
Furniture, rent.
Right, but we're only approving to move the $609,032.
It's
Right.
we're establishing the budget line, Jamie, because we can't spend it without opening a project for it. And so we're taking a portion of it that we're going to expend in 2020 of the county's fiscal year to open up that budget and project number. Does that make?
Right. Yeah, we're saying the same thing.
Okay,
Got it.
good.
Okay. Any more questions? Is there a motion?
Motion.
So move.
Second.
All in favor?
Aye.
Any opposed? Okay. Then we have amendment number for 555 building and maintenance.
That's amendment number 4, Jim.
Yes. Yes,
And this is
yeah.
the work to make the third floor suitable for the tenants in a competitive commercial office space market. Tenant forecasted for fiscal year 2020 chose alternate arrangements, excess budgeted expenditure dollars for utilities, office cleaning and parking be utilized to paint, carpet, decorate, and wire the space for the health department to lease for 12 to 24 months at $14.25 a square foot. Space would be designed for present and future tenant use. Okay. Any questions? Is there a motion?
So moved.
Second.
All in favor?
Aye.
Aye.
Any opposed? All right. This gets us to page 167. The capital improvement for the elevator. And this is just basically moving it from building improvements to or from equity in the pooled cash to building improvements. So we can repair and get our elevator working properly.
Yeah, essentially, we're saying we're going to self-finance this capital project with the healthcare funds, our emergency reserve, and utilize the $204,000 from, our cash on hand.
Anybody have any questions? Is there a motion?
So moved.
Second.
All in
Second.
favor?
Aye.
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 Any opposed? Okay. Now we are to page 168, the position control salary and wages.
That's for the fiscal year. This is our beginning. As you know, this is the time of year when we go over our fiscal year 2021 budget. So, Jim, you can give the highlights on the personnel portions.
Sure. It's broken up into a number of tables, but the first one is our current staffing, which is 81 full-time and 1 part-time, that we anticipate to be 4.3 million, 4.4 million for fiscal 2021. And then we're going to have new positions of 4 full-time, which would be an additional 235,000 in 2021, and we would eliminate positions that we no longer feel we need due to certain programs that don't exist, or and that would be a reduction of 267,000. And then the final part here is well, the next to the last final part is our vacant positions that we want to fill to fulfill our grants, which is 21 full-time and then 5 part-time for $1,062,000. And then the final part is the the whole actual contact tracing, which is 2,568,000 for this grant. So, but those would be temporary positions. So, so we're pretty. We've gone over this a number of times, and we're pretty confident that this is where we stand with this. Of this grand total for the contact tracing, we're actually going to move 217,000 into fiscal year 2020, which was the amendment that we just went through. But overall, we've we feel we have the position control that we want to utilize and fulfill all our requirements here.
Okay. So this is just informational purposes. We don't need to do anything with this at this time.
No, yeah, I don't believe so, because we're still we've still had new information that came to light, which was our allocation under the CURE award, which is the coronavirus emergency expedition, or and our allocation under that was which was almost $530,000, and that's on page 171, where I have these revenue streams. So we had the ones that are highlighted there is the RIG grant that we just discussed earlier for $31,000, and then the other change is that the contact tracing will be in 2021 $3.6 million, and then in 2020 $609,000. And now this bottom line here is we're not exactly sure what year that we're going to utilize this the CURE funding, because the CURE funding goes from March 1st of 2020, when the pandemic came out, to eligible expenses to the end of December. So we're not exactly sure. And I've given Dr. Martell some information on where I think we may end at the end of the year, but this was late breaking. So we're going to kind of go through that and formulate what we think best is for the agency here. So.
And just so everyone's clear, that was money that came through counties of over 500,000 population got money. Their allocations came through the CARES Act. Ours came through the CURES Act as a grant through the local health protection grant. And so it's a little more, the good news is it was directly allocated based on population and based on number of cases. There was a formula that was used. And so Jim and I are looking at how do we kind of back bill. So some of the environmental services, all of that stuff that would have normally come through. Again, kind of what do we keep and hold, what's necessary. A couple of areas we're looking at even right now as we speak is we know it's been difficult for some of the private school sectors and some of the daycares to get PPE. And so how do we begin to look at that? So he sent the allocation over a little bit late today. So we're going to continue to work on that. We did not expect an allocation coming through this fund. So I guess we will figure out a very expeditious and efficient way to use this money to address the COVID pandemic.
Okay. So that gets us to anything on page 172 or anything else that we want to go through, or is that the conclusion of finance?
Yeah, it's just summaries of the health fund, where we would stand now. So we're gonna make some changes, but as it stands now with our our running total, we would be having a surplus, forecasting a surplus in our budget of almost 655,000, and with the court fund, we would have a deficit of 293,000. So that's just kind of the running total update for you. or put something more concrete together, but that's pretty much where we stand right now with the numbers that have come in.
And so we expect over the next month to go over with the finance committee, because this is our budget preparation season for final adoption of the budget at the August board meeting.
Okay. Then I think that concludes finance.
All right.
Excellent. Looks like we have an interesting policy committee.
First on policy, I need approval of our minutes from the July 15th Zoom platform meeting.
So moved.
Second.
Any changes, comments? Okay, all those in favor?
Aye.
Aye.
Opposed? Opposed? All right. Committee considered a petition for variance from the Boland family on property in McChesney Park at 12220 Harbor Oaks Drive. The petition for variance is for the sewage system to use a holding tank. There's a building, a home there now, but it will be remodeled extensively. At least that's what was mentioned in the letter approving or recommending we approve it from the Village of McChesney Park. They mentioned that it would be a remodel of the existing structure, but I guess it's going to be an extensive remodel. This piece of property is in the floodplain. The septic system no longer is viable. They want to use a holding tank. The department staff has recommended approval, and the committee has agreed with the approval with some provisos. And those provisos or requirements are in your packet on the last page that you have, which is 181 and 182. And it sets out the requirements or conditions that have to be followed for approval of the variance. So this committee meeting on this, we had some guests, which was exciting. 3 guests on the Zoom meeting, so that was different. Todd, anything else on this? We added some things to the requirements in the committee meeting. Those were the last 2 things you'll see on the page 182 is what was added at the committee meeting, but quite an extensive list of conditions.
I think that was very well explained and presented there. Yeah, the 2 things that we've asked for, obviously you do see in there with the recommendations, we did add on to it. I don't know if sewer would ever come, but yeah, let's get it on that piece of paper on the variance. And basically saying if public sewer is within 300 feet to the nearest property line of the building served, the holding tank, they agreed to hook up. The other one, I'm still working with the village. I did reach out to them, trying to get more clarification on their letter of approval, basically saying remodel to the existing structure. What does that mean? Do they have to keep the original foundation or keep one wall? That's what we have heard through them, but we don't have anything in writing. That's what I've been asking for, and I have not received that yet. So,
whatever their requirements are, that's what we want met. We're just not sure what they are.
Exactly.
And what we found in the committee meeting was that the engineer for the project thought they were going to completely replace the building, but that's not what the Village of McChesney Park said. They were going to be remodeling the building, and that's what the basis of our approval of this variance is based on them remodeling the building. Now, granted, it's going to be extensive remodeling. It may just be a wall left there or something. Whatever their requirements are, but that's their requirements. That's got nothing to do with us.
That is correct. That's what I asked for, that clarification. What's in their ordinance regarding that with remodeling? What is the definition of remodeling? How is this being implemented into this project? That's what exactly. So I have not heard any response back from them. I did call and email, and I have not received.
Well, the committee recommended approval to the board with these conditions. The only question I had at the meeting, other than what we'd already covered, was the surety. Maybe Charlotte's had a chance to look at it, I'm not sure. But who's the surety bond paid to? We don't know yet. I'm just not sure who's responsible if something goes wrong.
Most likely it would be the county that would be responsible for cleaning it up. So it should probably be made payable to the county. I think that's what Dr. Martell and I had discussed.
Okay. I'm just glad it's not us.
Sure. How
So
close is the property to the current sewer system? I mean, obviously not within the 300 feet, but
Not even close. Probably a quarter mile away. Ventura is very very up and down, and they take a lot of pump stations and all that through Ventura, which Harbor Oaks is off of Ventura. And the conversation I've had with the sewer district for years, because we've had flooding issues on Ventura. It'd be a very extensive project, which they haven't even discussed about even ever running sewer down Ventura. So
this property is right on the river, by the way.
Yes, right on the river. It's actually lower than Ventura Boulevard, if everybody's aware of that. Harbor Oak is a lower elevation than Ventura.
So the committee has recommended approval. I don't think we need anything else other than discussion on it.
Perhaps we should lay it over until we get all the information we need.
Well, whatever information we get won't change the conditions we have. The conditions are only going to be.
This is true. But I'm truly very interested to find out from McChesney Park, because I want to see that in writing of what they're saying has to be left and considered that house then to be a remodel, because I think it's more than one wall and they're not committing to it. They should have committed to it by now. I really would like to lay this over till our next meeting.
I'm sorry, who should commit to it?
McChesney Park.
Well, McChesney Park has their rules on how to handle this, and we can't change
I'm sure they are, but I'd like to see it in writing.
If we see it in writing, what does that do?
It gives us a leg to stand on, because then if they don't have what, if it's going to be one wall, I even want to know which wall. Is it a garage wall or a house wall? We've done building down there before, and usually when they build property, rehab properties like that, they even have to keep so much of the original house. They can't just take one wall.
Right, which is up to this village of McChesney Park to make sure they do, not us.
I want it in writing from them.
Is there a
for? Because it does say receipt of confirmation from the village that conditions have been met to define the work as remodel.
Right.
And it doesn't matter what those requirements are. We don't have control over those requirements. The village does. So they could say it's one wall, three walls, the garage, whatever they say. If it's met, then there's no problem with meeting the conditions on the variance request.
And if we don't get that confirmation, then it's a no-go.
Right.
Right, Todd?
Correct. Yeah.
Yes. So, any other discussion?
Precedents too. I don't know in the future here. It's a good question to ask. They do put it in writing, and I'm curious what that is. But
we need it in writing.
Correct, but you would not even sign off on this permit. The board would approve the conditions, right? Advancing the conditions on the approval. They would have to submit those before we would sign off. So are you saying you'd want to revisit the decision based on what the Village of McChesney Park's requirements for a remodel are?
I don't even want to vote on that this tonight. That's why I'm asking this, lay it over till we get all the information that we should have.
Well, we already approved this in the committee based on the information we had, and knowing that the Village of McChesney Park has to approve has to approve whatever is done. And that part of our condition is that it's going to be met by the village, that the village is going to be satisfied. And we don't have control. If we're going to change to, you know, if it's one wall or three walls, and we're going to change whether we approve the variance or not, that's, I don't think that's acceptable.
Can I make a suggestion?
Yeah.
On that condition, maybe we want to add at the end, prior to a permit being issued, just so
Right.
it's clear that they have to submit that before any permit will be issued, because some of these conditions don't have to be met before the permit is issued.
That sounds good.
Yep, I like that, Charlotte. Then we just won't sign up. We can approve it, but I will not sign off on it until I have that information.
All right, so I need somebody to make an amendment.
I'll move that we add that to the sentence about the confirmation from McChesney Park.
I second the amendment.
You okay with that, Christine? You got it? Okay. All right, let's have any other discussion on the amendment. All those in favor of the amendment? Aye.
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 Opposed? Okay, so now the recommendation to the county, the health board has been amended. Now we need a vote on the variance itself. Any other discussion on that variance? Okay, I need a vote on all those in favor of the variance as amended, say aye.
Aye.
Excuse me, opposed till you say with conditions. We approved the variance with conditions.
As amended.
As amended.
Just all the conditions, and yeah, and as was amended, but it's got to be with the conditions. You can't just approve it without approving the conditions. On zoning, that's how we have to do it. So you want
the
sure
recommendation. The recommendation from the committee was to approve the variance with these conditions, and now those conditions have been amended to add the language we just talked about.
Yeah, and we will change then on this document, we will put then to variance conditions. So that when it goes to the homeowner, they have that list of conditions attached.
That concludes policy.
Excellent. Personnel and quality. No minutes. Any new business or correspondence? If not, we need a motion to adjourn.
Make a motion to adjourn.
But Pat needs to. or Mike.
Pat?
I just want to shout out for Christina for all those wonderful page numbers on the agenda.
Shout out.
That was work, and this is the first time I've been able to keep up for a while.
Me as well, Pat.
I agree.
Agreed.
Excellent.
Do we have a motion to adjourn?
We did.
Almost.
Second?
Second.
All in favor?
Aye.
Aye.
Thanks.
We are adjourned. Thank you.
Thank you, everyone. Have a great week. Stay safe.